There's a shortage of the RSV drug for infants. Now, health experts are pushing pregnant mothers to get the RSV vaccine in hopes of protecting their babies. Dr. Larry Kosiolek is an infectious disease medical director at Lurie Children's Hospital of Chicago and joins us now to talk about this. Thank you so much, doctor, for being with us today.
Great. Thanks so much for having me.
Let's get right into this. So the CDC is encouraging pregnant mothers to get the RSV vaccine. How can this protect their unborn child?
So RSV, or respiratory syncytial virus, is what doctors call it. It is one of the most common infections in infants and can cause a pretty serious respiratory illness. It's exciting. This is the first year we have new medications to prevent RSV in all infants. One medicine is a vaccine to be given to pregnant women late in their pregnancy. And that vaccine gives the mom antibodies who can then pass those antibodies on to their baby to protect them against RSV after the baby is delivered.
If there's a mom out there right now that may be leery of this, why would you say that she should go ahead and make sure to get this vaccination?
I can tell you RSV is very scary. If you talk to parents whose babies have had RSV, while many will have a cold or a mild illness, many more can have a very serious respiratory illness that requires to be hospitalized, sometimes requires oxygen, sometimes it requires a ventilator and a long stay in an intensive care unit. And every year, RSV can kill hundreds, if not thousands, of babies in the United States. And so having something that can prevent this severe infection is really exciting. Vaccine tested in very large clinical trials is shown to be safe and effective and is a really excellent option to prevent the serious infection in babies.
Dr. Kosiolek, I know last year we were talking about this on the news. There was a 3% jump in the national mortality rate for newborns caused by RSV infections. Why that huge jump? And what is behind that change?
That's a great question. You know, we see year-to-year variation in the severity of RSV. There can be different strain types. Also, depending on how old you are, you may have not been exposed to RSV in the past, and so you may have no immunity to that virus. And so when you're a young baby, several months old, less than a year old, and you've never been exposed to this virus, seeing it for the first time can lead to a very, very serious infection.
Well, we appreciate you coming on and talking about something very serious that could impact so many children in our community. Dr. Larry Kosiolek with Lurie Children's Hospital, thank you for joining us today.
Great. Thanks so much.